It's that time of year when the weather gets colder and the viruses get bolder. So it's time to take your flu shots again, and doctors say you might consider taking the new COVID shot as well.
So COVID, I think most people would agree, is endemic, just like influenza.
We know COVID circulates all year round, but we know there's more of it during the fall and the winter seasons.
There will be 3 COVID vaccines available this year. 2 are mRNA-based and 1 is protein-based. They are all optimized for new mutations of the Omicron variant that have emerged over the last year.
They are matched to the XBB 1.5 variant, which came out in January 2023. So, COVID is constantly changing. And so we have to start updating the vaccine to what the main circulating strains are.
The vaccines from Pfizer and Moderna that are coming out are more closely resembling what's circulating now. The Novavax vaccine is more resembling the virus that was circulating last winter.
Dr. Bogosh says while everyone may take the vaccine, there are some vulnerable groups that should ensure they're up to date with their shots.
In terms of people who should be getting their vaccines are people over the age of 65, people with underlying medical conditions that put them at greater risk for severe infection, people who live in congregate care settings like long-term care facilities or elders' lodges, Indigenous communities. The goal here is obviously to reduce the risk of severe manifestations like hospitalization and death. All of the vaccines that are available will help accomplish that goal.
Both doctors also warn about respiratory syncytial virus, or RSV, that also tends to surge at this time of year.
RSV is really the number one reasons for babies to be hospitalized around the world. The younger you are, the more likely you are to have severe disease. But also, if you're Indigenous in certain communities, like I've been studying Inuit babies for almost 30 years, they have multiple risk factors for having very severe RSV.
And like the flu, RSV can also be more severe for older adults. A vaccine for the virus was approved in Canada last year.
Some Canadians have already received it. The interesting thing about this vaccine is it appears to have a much longer time frame of efficacy. Okay. It looks like it lasts for about 2 years, maybe even a bit longer.
And Dr. Bogosh adds that if you don't have a family doctor, there are a number of healthcare professionals like pharmacists or nurse practitioners that can answer your questions and help make a decision about getting vaccinated. We've got an explainer about this year's vaccines on our website, citynews.ca. For City News, I'm Dilshad Burman.